Welcome to this video on getting ready for your first appointment at Resonance Wellness. My name is Dr. Alyssa Gall, and I'm so pleased to take this moment to lead you through what your first appointment with me will be like. Watching this video will save us time in your appointment so that we can get right to business. To start with, make sure to check your email for the welcome email that came from info@resonance-wellness.com. Attached to that email are the documents that are either required for your visit or give you more information about my practice. My intake form is a 16-page form that on average takes 1 to 3 hours to fill out. Yes, you heard right. I want to know everything about you and your health, and the comprehensive patient profile helps me to quickly ascertain what in your health picture is related and how to group your health experiences and symptoms together into usable concepts that will guide your treatment. We like to have these forms 24 hours prior to your appointment. You can fax or email them. Next is an informed consent, which you should sign and return to us. Then there's a welcome letter, a frequently asked questions document, a map on how to find us with parking referenced, an article on how to be a great patient that helps you be as prepared as you can be for your appointment, a records request form to sign in case we need to get records from other providers, and a fee schedule. So, what did you get yourself into? A naturopathic doctor is a lot like your family physician. We undergo 4 years of medical school after a bachelor's degree. We write licensing exams. We have a primary care scope of practice that depends on the province or state that we practice in. More about this later in the video. What is different about an ND is that my philosophy of care is different and the treatments are different than your family physician. Philosophically, I'm there to see the big picture of how you've come into your health trouble. I'm there to teach you and guide you on how to mitigate or resolve what you're experiencing right now using a range of natural therapies, techniques, and lifestyle measures. And I'm there to work with health providers on your team to get you the best health results. I just want to take a moment to plug again about your intake form. The time that you spend on this is well spent. The more info that I can assess about how you got to this point with your health really helps me to help you save time and money, so do your best. Now, you may also want to take a moment to click on our clinic website to the medical records binder. Because I see so many patients with complex health histories, I know what having all of the records can mean to your health providers. The binder materials are free to download and put together yourself, or you can buy a pre-made binder at the front desk. Once you get here, the first thing we'll do is sit down together and review your forms. If I got the form in advance, I will have already read through it and I will already have a sense of what's going on with you, but this gives me a chance to ask you clarifying questions. By the end of the review, I should have a pretty good idea of how to approach your case. After the history, I often utilize autonomic response testing, a kind of applied kinesiology that helps to confirm and clarify which areas of the body are in need of support. We may discuss doing lab tests to investigate your health further. Besides the typical types of screening lab tests, NDs use many specialty types of testing for hormones, allergies, toxin exposures, gene testing, and functional assessments. We may also request copies of tests you've already had to prevent duplicating data that already exists. It's my goal to have a short and long-term treatment plan in place by the end of your first visit. The average plan has 3 to 5 stages where we're working on a plan for 6 to 8 weeks per stage. This way we can take care of the most pressing concerns or issues that need to be cleaned up first and then reassess after each phase. This way we can have an immediate symptomatic effect and make headway on the underlying causes of your health issues at the same time. Natural medicine may take a little bit more time, but it's because we have to wait for your body to respond to the changes that we're making, and this type of healing doesn't happen overnight. That said, I will be able to give you an estimate of how long certain issues will take to resolve during our discussion. On a treatment plan, you may find a change in diet. Changes in what you eat can have a profound impact on your health. I may suggest small changes to do with certain symptoms, or we may use a more detailed analysis to determine what the biggest dietary issues are. For example, I may use metabolic typing to match a patient to their best diet, or I might use an elimination diet for sensitivities. I may also suggest physical medicines, done either by myself or other practitioners. I have a great deal of experience in treating pain conditions and musculoskeletal or joint issues. I can help assess who might be of the most help to you amongst the various types of manual practitioners. I may suggest herbal medicine. Herbal medicine is the use of the tea or extracts of plants in liquids or tablets. There are an incredible number of therapeutic plants at our disposal with specific and reliable impact on health conditions. I often use nutritional supplementation, where complexes of vitamins, minerals, and other nutrients used in our biochemistry are combined to support function and enable repair. In this day and age, it's not unusual for specific deficiencies to exist, which are creating conditions where the body cannot heal in specific organs, glands, or other tissues. In your treatment plan, we may also use homeopathics, which are medicines that send information to the various parts of your body to resume normal function. Homeopathic remedies are very useful to get a body area to respond properly to healing impulse. We may use mesotherapy to help repair skin or stimulate connective tissue to repair, or use neural therapy for pain from injuries or prior surgeries. We may use vitamin injections to give a rapid boost where a person is too deficient to get a quick response from a diet modification or oral nutrient supplementation. I'm trained to use the normal primary care drugs that you expect your family physician to use. However, we do not have prescriptive rights in Alberta. Most NDs do not focus their plans on drugs, of course. However, because of this knowledge, an important part of the treatment plan is to check what you're using now for adverse effects and nutrient depletion. Many drugs selectively deplete specific nutrients over time, and this can actually create significant health impacts that are so gradual you don't realize that it's medication causing it. I also check supplements and drugs for interactions using a professional database designed for this purpose. This can help make sure we're not adding to your burden. NDs can do minor surgery. There are a handful of little procedures that are safe to do without pharmaceutical backup, like the removal of tags or taking out stitches you've had put in, or sliver removal. If you have something that requires more than that, we can refer you on. If you need specific help that I can't provide, I have a database of practitioners that I know and trust that may be helpful in your case. Because my referral practitioners have a good sense of what I do, we can really utilize each other's feedback and plan for you. Next, we'll determine when you should follow up, tailored to create support around your plan. Like I mentioned before, you will usually have a 1 to 5 phase plan, or you might have a specific set of tests or a therapy we want to utilize, so we will plan when we should see you next and for what. We recommend that we get this organized while you're still here. The day after your appointment, you'll get a follow-up email that contains information about how to use your treatment plan, how to access the patient portal so you can find another copy of your plan or book online. We also send you information on the natural remedies that we use and some more how-to info. You'll receive a sheet on pager services and on phone consults. If for some reason you've forgotten or life got in the way, we will automatically email you after we expect your first phase to be finished, if we've seen you or not. Don't worry, we'll keep you on track. We have an on-site dispensary where we carry the majority of items that I might recommend and from which we can order special items as needed. Our clinical assistant works in the dispensary and she will help you read through your treatment plan, identify what you might be taking home, and how to use it. Feel free to walk right in. Our front desk assistant will get you the handouts I've suggested that you read, check you out, and make your next appointment. Don't forget to sign up at the patient portal. This is a great way to keep in touch with us. If you're interested in receiving our newsletter, sign up at the front desk or online. And don't forget to check out the Whole Life Medicine site where we post our handouts on products, labs, conditions, and where there are questionnaires and further info. I'm so excited you're joining me. I'm looking forward to being your guide and partner on your journey to health.